Good evening. It's my pleasure to present Dr. Paul Farmer with the University of California Berkeley International Public Health Hero Award. Paul Farmer is a doctor, a public health worker, an anthropologist, a professor, and a social activist. He has saved and improved the lives of many, many people and inspired countless others. Paul co-founded Partners in Health in 1987, a nonprofit organization created to bring health care to Conge, a shanty town of displaced farmers in the central plateau of Haiti. When Paul first arrived in Conge, it was one of the poorest regions in one of the poorest countries in the world. As Paul elegantly puts it, the shafted of the shafted. 30,000 people live there, but not a single doctor. Paul and his team built literally from the ground up a public health system and a hospital. This small community clinic has grown into the Zanmi La Santé socio-medical complex, featuring a full-service hospital with 2 operating rooms and a full range of modern medical services. Today, Zanmi La Santé ranks as one of the largest non-governmental healthcare providers in Haiti, and it's the only provider of comprehensive primary care, regardless of ability to pay, for more than 500,000 impoverished people living in the mountainous Central Plateau. Today, Partners in Health serves millions of people in 10 countries, including the African nations of Rwanda, Malawi, and Lesotho. They employ more than 5,000 people worldwide, the vast majority of whom come from the poor communities they serve and have never held a job before. Dr. Peggy McAvoy, the retired Caribbean chief of UNAIDS, once said about Dr. Farmer, in reference to his work on HIV and AIDS, "If you had 25 Paul Farmers in Haiti and the Dominican Republic, then you would be well on your way to stopping the epidemic." Dr. Farmer, for your courage in leading the way towards establishing a new model of sustainable community health care for the poor and underserved, please accept my congratulations to you as a public health hero. I am honored to have this opportunity to thank you for your lifelong dedication to improving the world we all live in.
Thank you very much. On the way in here, first I'd like to thank Congresswoman Lee. I think you guys are very lucky to have someone like that as your Congresswoman. I was lucky enough to meet her a decade ago, and really people like Congresswoman Lee restored my faith in public service. On the way in here, I got to speak a little bit to Jack Wenberg, who's a public health hero of mine. And I realized, where are you, Jack? Where are you? Where's our hero? There he is. And we began dueling, really. And one of the things that he said to me, which I think all of you will enjoy, is, "Oh, you think you've got it bad. At least you get to work in countries where there is no healthcare infrastructure." And, you know, I found that strangely compelling. In other words, if there is no healthcare system, no one's going to die of medical error. Anyway, I think that's right. I am very happy to be back at Berkeley and to close out the evening. I'll be very brief. I should be out of here in another hour and a half. I gave the graduation speech at the School of Public Health 4 years ago, and I had determined after 2003 that anytime I was invited to give a graduation speech, I would talk about war, about the war in Iraq. And let's just say, what was you said some of our presentations have been downbeat. Well, I gave a rather downbeat speech, and I thought I'll never be invited back, even to Berkeley. But I was, and I thank Berkeley, I thank School of Public Health. It's Steve Shortell, who actually, I'm kidding because I think that my graduation speech was well received. I also want to thank the students who are here and the ones I had the pleasure to meet yesterday. Fantastic students at Berkeley, as has been the case for so long. By the way, yesterday, you'll be glad to know, that someone from the audience, that a really big crowd, of course that's always possible when you put it in too small a room. There was a really big crowd there, and someone got up and said, well, you know, Dr. Farmer, you're something of, you said this even worse, the rock star thing, you're something of a public health icon. And I said, well, actually, I'm more of a public health hero. They laughed because they knew I was getting this award tonight. So the students, some of whom are here tonight, many of whom are here tonight, I just want you to know that you guys are my retirement plan. And it's, all levity aside, it's really an honor to work with this new generation of young people. And I think everyone who teaches public health and medicine feels the same way. That I'm sitting with a table of my friends, and some of us teach public health, some of us are involved in public health, but I don't think any of us believes that we're not living in a really remarkable time as far as public health goes. And so those of you here tonight who have been deans and teachers and professors for the last 15, 20, 30 years know that this is the case, that we are really seeing some of the best and the brightest turn, not to anything other than public health. So really my thanks are to the students. Steve spoke about the challenging times we live in. He mentioned really that public health is challenged. And that may be true. That's always been true. It's been true since the 19th century and before. And the director of our organization, Partners in Health, in a speech not too long ago said that the panic on Wall Street is nothing compared to the panic of being a mother who doesn't now know how she will feed her own children. I think there's a great truth to that. These are difficult times for many of us. Thank you. You may feel free to applaud, as my own friends. These are difficult times for those of us trying to move resources, and Don Francis gave a fantastic set of comments, as usual, about this topic. It's not too much to ask that we invest in public health and public education. It never has been too much to ask. And these are challenging times, it's true. But they're also very blessed times. They're times when we can really make a difference. And the students here in this room have underlined this again and again. I think this was your point, that we can do more and we will do more. And I'd like to finish by just saying that I very much agree with the model that Berkeley has adopted: create, apply, engage. That's what's going to generate real public health heroes. And then finally, I'd like to, I said finally twice, didn't I? This is a problem in my public speaking that I will try to eradicate. The real public health heroes. A couple of people were up here and talking about unsung heroes. And I'd like to mention in passing community health workers. Community health workers are, in my view, the unsung heroes, along with the mothers who I mentioned, the families who soldier on. And I'm not, after my dreaded graduation speech, I shouldn't use any more military metaphors. But actually, military metaphors are front and central in public health. But these are the people who soldier on. The patients themselves, those at risk, because we don't want to just think about patients, but rather how to prevent illness, and their family members, but also the community health workers who live in great proximity to patients. They are the real unsung heroes in public health, in my experience. And if doctors and nurses and public health specialists can somehow make common cause with the general public to create more and more opportunities for all of us to be involved in public health, I think that's how we're really going to move forward this agenda. Thank you all for including me, and it's a real pleasure to be here.